Well, there have been mixed reactions and a bit of confusion, actually a lot of confusion, after Parliament's National Assembly passed the National Health Insurance Bill recently. This also comes after Parliament's Select Committee on Health and Social Services also posed several questions to the Department of Health, including how the bill will improve the health infrastructure and assist to increase the number of health professionals that are needed at healthcare centres, especially in rural areas. Also, how the department plans to address the current challenges of poor service delivery in the health sector. Many advocacy groups, that's including the Board of Healthcare Funders, which represents medical aid schemes in Southern Africa, and civil organisations such as Solidarity, have added their opinions to the mix. And to better understand the bill and what it hopes to achieve, we're joined virtually by Connie Mulder, who is the head of Trade Union Solidarity's Research Institute. And here with me in studio, we've got Dr Katlego Mothudi, who is the Managing Director of Board of Healthcare Funders. Gentlemen, a pleasure to have you. Thanks very, very much for joining us, Doctor. Good to have you here in studio with us. And Connie, thank you for being with us online.
Thank you.
I'd like to, let me begin with Connie. I've got you virtually, so let me begin with you. What are your views on this entire NHI bill, and what do you stand on some of the developments we've seen happening this past week?
Well, firstly, good morning, and good morning to the good doctor there on the couch. I think Solidarity's views on this are quite clear from the very start. We think this bill is in three dimensions: completely unaffordable, unworkable, and unnecessary. On the unaffordable side, I think this was in our parliamentary presentation, which we told the Portfolio Committee, from our costing estimates, and it seems like we're the only ones who actually did a costing estimate. This would cost almost 400 billion rand to implement, as Africa does not have that type of money. Just for the average man on the street, when we're talking 400 billion rand, that would equate to either a 5% raise in VAT, or a 20 percentage point raise in personal income tax to be able to fund this through taxes. And it's just unrealistic. There's no way that South Africa can even talk about implementing this, yet government has steamrolled through and tried to still get it through. On the second hand, on the second point, it's unworkable, as we've repeatedly seen, and we represent several medical workers, and 85% of these say that they will either leave the country or the profession if this bill goes through, due to the massive impact that it has on them. A large extent of these, I think it's almost 70%, said they have no idea what is covered and they don't see a future in medicine if this bill goes through. So the question we've asked government is, who is going to provide the healthcare? Because you've clearly not engaged with these stakeholders and you've not told them what's going to happen. We still don't know. You're right with confusion. We don't know what is going to be covered through this. We've repeatedly asked government to say what will be covered, what won't be covered, and we've gotten no answers. And then lastly, it's unnecessary, and this we focus on. We're not under the impression that healthcare in South Africa is in a good space, but we're of the opinion you first try to fix what you have before you start trying to reinvent the wheel. Now, at the moment we're in a situation where our Department of Health actually gets hospitals who get unqualified audits. We've got the mismanagement sorted out in most of the hospitals. Then we can have an argument as to, is the system still adequate? But in South Africa, we're spending billions of rands on a healthcare system that has serious flaws in it, and the answer of the NHI to this is to say, but let's spend a couple of billion more rather than trying to address the existing health infrastructure's crisis. And that's why we've seen this, it can work, the existing structure. It works in the Western Cape, and there's no reason it can't work in the rest of the country. And we're of the opinion, before we do this piece of legislation, that would really create chaos in healthcare, and from our perspective, destroy the private healthcare sector. Let's first try to fix what we have, then we can have an argument.
All right.
We're so furious about this that if this bill goes through, we've repeatedly warned government, we are going to court straight up and saying that it's unconstitutional and it's irrational.
Okay. All right. Let's get the opinion now of Dr. Mothudi. And of course, the Board of Healthcare Funders is the largest healthcare funding association representing the majority of medical schemes in Southern Africa. So where do you stand? What are your views on this?
We are concerned with the bill from several viewpoints. The first issue is that there's a narrow focus, just looking at what the bill says and what it's supposed to do, instead of looking at what else needs to be done to make sure that we fix our healthcare system. Now, looking at the bill, and I think Connie has articulated some of the concerns around the constitutionality, implementability of the bill, etc. We've also looked at those, and we think that there are many areas that can be strengthened. The second area is what else can be done. The select committee asked very pertinent questions. What about the health workforce? What about self-delivery? What about infrastructure? And those are the elements that are very important to fix the country. Just thinking that signing this bill into an act would fix the current challenges is actually, I would say, narrow in terms of the thinking. We'd like to look at other frameworks that have been proposed by the World Health Organization to start crafting those strategies that will make sure that when we fix the healthcare system, we are looking at everything else. So the issue of the health workforce, are we investing enough money to make sure that we train doctors and nurses? And once we train them, are the situations or conditions in the country adequate to make sure that we retain them? What about medicines and vaccines? We hear issues of stockouts in certain facilities, etc. While there are maybe ramblings of certain plans, but they're not coming to the fore as prominently as the bill is. What about infrastructure? We've had reports from as early as 2012 when the bill was being formulated and there was a pilot project. We had that many of the institutions in the public sector could not be found to be up to the standard of the ideal clinic. We've been told that there's some improvement, but there's also regression. And some of these issues actually vest solely in poor leadership and mismanagement. So we have to look at broader issues than just the bill to make sure that we fix the
and that's I think the key and at the heart of all of this is getting into the nitty-gritty of how it all works. And it seems that there's a real void of information that's happening right now. And I suppose an important question to ask, and perhaps very quickly to both of you, the National Assembly said that the Portfolio Committee on Health and Health held public hearings and consulted and sought extensive legal advice from Parliament's legal unit and its state law advisors on this particular bill. What role did you play in these hearings at all, if any? Did you play a role?
Definitely. The Board of Healthcare Funders has always participated from as far back as the Green Paper and White Paper. We've made submissions. And we're also one of the 135,000 or so submissions that were made to the Parliamentary Portfolio, and we continue to do that. We know that there's an opportunity when it's going through the NCOP for us to comment, and we'll actually encourage people to do that. It is concerning that there was very little in terms of uptake of the various comments that were made. I think a lot of organizations were worried about governance and leadership components of the bill, the issue of whether it will pass constitutional muster, etc. But those were not really regarded. And even at the Parliamentary Portfolio Committee, you saw the state legal advisor as well as the parliamentary advisor being at opposite ends. But we didn't see some of those comments filtering through currently. But we still going to participate in the process in the town hall meetings that are going to be set up at the provincial levels.
Okay. Connie, from your perspective, was there any engagement as well from your side?
Oh yeah, I think the main frustration we've experienced is that we've been engaging constantly, yet government seems to be very reluctant to even participate. The best example of that would be government not actually showing up for the certificate of need court case that we had. They literally never responded to any documentation, given the importance of NHI. We partaken and participated in the public process. We had a parliamentary portfolio committee presentation where we explicitly detailed what we've seen. We shared our research, we shared our legal opinions. We had all of these things, and there was almost no changes to the bill as it was rushed through Parliament. I think the reason we're so concerned, we'll obviously continue taking part of the process, but we're busy preparing court documents because we foresee that this will end up in court. There's no way it won't. And the reason we're so concerned is this isn't any other commodity. This is healthcare. That means if this fails, we're going to sit with health shedding, quite simply put. And for our perspective and for that perspective of our members, this is a massive problem and a massive threat that they're facing and the country is facing. We cannot afford to play games with people's lives, as government quite frankly is doing with NHI, especially if you consider these are the same people who did life as many, and now they're trying to take that level of standard and governance and apply it to the whole healthcare sector. And they're surprised that there is a lot of resistance coming from civil society. So we will participate in the process until the very end, and then we will be going to court if they continue down this path. That will only lead to ruin and ultimately to equal access to everyone, yes, but we'll have equal access to no healthcare.
Yeah, and that's the reality is that, and Dr. Mothudi, I mean, this is all about universal healthcare. At the end of the day, this is what this entire bill is about getting South Africans, because there is a problem with our healthcare sector, and there are problems when you look at the inequality when it comes to those who can access healthcare and those that can't, and this is at the heart of all of it. But I suppose the question is this achievable in its current form, the way things are being put forward? You yourself, as the Board of Healthcare Funders, you're actually saying that in its current form, I'm quoting you, this will actually hinder the achievement of the global agenda of universal health coverage by 2030. Perhaps you want to tell us a little bit more about that. What about, in its current form, is going to hinder this achievement?
There are a few angles to look at it. If you want to increase access, you need to make sure that, one, that you consider all the resources that you have. I've already mentioned some of the elements. Just having this bill signed into an act as law does not deliver us to universal health coverage. Yeah. We have to look at all the other elements. The other thing that we have been speaking about is the role of the private sector and the medical aid schemes. Section 33 and I think 6.0 of the bill talks about the role or the reduced role of schemes. And what we've been saying is that medical aid schemes and other private healthcare funders have got a lot of expertise and the necessary systems to actually assist government. Now this, if there was any doubt, was demonstrated ably during the recent COVID debacle that we had. We saw government working hand in hand with the private sector to make sure that there's access to hospital beds, to vaccines, and there was funding from both sides. There were systems that were deployed from both sides. Now, if you want to take out what we think is a national asset as well in terms of the schemes and the private sector out of the equation in terms of finding solutions, we're actually disabling the process. We are actually limiting the access that could be provided by collaborative measures.
Yeah, and that's a problem. And one of the other big problems is the funding of all of this, because Connie, do we know how it's going to be funded? Because I mean, a lot of people are thinking, and assumptions are that those individuals that are already on a medical aid per se will be taxed more, and this tax will be what is going to be funding this NHI. But perhaps you know a little bit more, or do any of us know how the funding is going to work?
No, we don't. The white paper, well, that was ultimately before Parliament, basically stated that it will be funded from the tax base. I know government officials have repeatedly stated that they're going to use private medical aid contributions and just turn that around into tax. That is a very interesting way of thinking about private citizens spending their money. The equivalent would be government going through having an official at the end of your checkout at Checkers or ShopRite, looking through your basket and saying, well, you're spending too much on this, and this is your private money, but we think we should be getting a bit of this bread or a bit of that milk. And that's why we're really concerned. The reason people are spending so much on private medical health is because the public health sector has, for all intents and purposes, in several parts of the country, imploded. And I think that is our main concern. So there has never been of the opinion the current healthcare, the status quo is where we should be. Obviously, this is not. But we're in accordance with the national, with the health market inquiry, as well as the competition from the competition commission, as well as Prof. Alex van der Heever from WITS. We commissioned a report that says yes, we need to fix South Africa's healthcare, but this is not the way. This is akin to somebody who's getting into a car, driving down the road, and then hitting every single obstacle. And then when they get out of their driveway, instead of saying I should go for driving lessons, they decide, well, maybe I should be flying a Boeing. And that is exactly what our concern here is first fix what we've got, fix the mismanagement and fix the systemic failures that we've seen in healthcare. And then we can start talking about completely revolutionizing healthcare, which will, in essence, as the doctor pointed out, will in essence destroy private medical health. Private medical health is one area of the healthcare in South Africa that is still working fine. And we should rather try and get more access if we can, but ultimately focus on what works, rather focus on what's broken than trying to for some weird reason, destroy what is working.
I don't think anybody can deny, when you look at the state of a lot of our public healthcare institutions and our hospitals, that they're in a dire condition, and it's a big worry, and that's something a lot of people are. I'd like to end off and just, Dr. Mothudi, I mean, if we look at what's happening, I suppose, when we look at the UK's NHS and then what we're bringing in the NHI, very similar concept, but NHS is struggling right now. I mean, we're seeing, as of today, that there is one of the biggest strikes by doctors ever that they've held in the UK with regard to what's going on. They're saying that 7.4 million people are on waiting lists for surgeries and procedures, 8,500 unfilled positions. This is happening in the UK. What would happen here in South Africa if in its current form NHI goes ahead?
Yeah, I think we have to accept that no country has got unlimited resources. And we applaud government's intent on trying to make sure that there's equitable access. But the approach has to be in a way that would ensure that the endpoint is actually achieved. And I'd like to emphasize the issue of collaboration, making sure that whatever resources that we have are actually used correctly. One other issue that is important is that we cannot throw money at a problem and think that it will solve the issue without fixing other things, especially around leadership and governance. And we see that sometimes the maladministration and rampant corruption are actually the biggest inhibitors. There are some provinces that are doing fairly better than others. Maybe it could be argued that they are managed better. So we have to make sure that we don't try to find quick fixes and find the right solutions and put a think tank that will make sure that we find those solutions from all the sectors.
Gentlemen, thank you for joining us. This is the start of a long conversation. I know we'll be chatting to a lot of guests, but I'm so glad that we had the two of you starting it off. Connie Mulder, Head of Trade at Solidarity's Research Unit, and Dr. Katlego Mothudi, who's the MD of the Board of Healthcare Funders, talking to us about the National Health Insurance Bill and its impact.